Hi friends, welcome to today's video. In case you don't know me yet, my name is Freya. I am 46 and our family is trying to grow. We want to try whatever we can. We've had one frozen embryo transfer that was a donated embryo in Prague in a clinic. You can watch my videos. I will link one up right here. I had my miscarriage 2.5 weeks ago. That's when it started, and that's when most of the tissue came out. It kept on bleeding for a few more days, for about a week or so, and then it got a lot less. And then it's been just almost like spotting a little bit. So some days there's absolutely nothing, and then some days there's the tiniest bit of spotting. This week on Thursday, today's Sunday, I had an appointment with my OBGYN. He did an ultrasound and he said there was still a piece of tissue. I don't know, he said maybe about like this size right here. So not really tiny, not gigantic, because I had like pieces this big come out. And he said, well, we might still need a DNC if it doesn't come out. And if you know me, I'm all about natural because I'm so amazed at how well my body handled the miscarriage. I had another miscarriage 2.5 years ago at 7 weeks. This time was 10 weeks, but 2.5 years ago, I was pooped. My iron levels were so low. I didn't feel good for weeks and actually for months until my cycle was back to normal. So I did a lot of things this time with herbs, with natural remedies to help my body, just to support. And so when my doctor told me, well, we hope that it still comes out, because then after all, that would be too bad that after it's gone so well so far with your miscarriage, everything natural, it would be a shame if you still needed a DNC. And I was just thinking to myself, no, I'm gonna try everything to avoid that. I feel so good, so I know what to look out for. If there's any sign of pain, or I feel bad, or there's a fever, I do take my temperature every single day. I'm gonna get to that also. If there's any signs of that, I'm gonna of course go see a doctor right away if there's an infection. That is absolutely clear, and I'm very grateful. I have a hospital close to me in case there's anything emergency wise, or I can go see my doctor and they can check again. And if it needs to be, I would totally have a DNC, but I just don't like the idea of always immediately jumping to the conclusion of like, well, we need to do a DNC, because I am patient and I just want to give my body a chance to do what it needs to do. It just needs time maybe. So what I also did is I talked to my midwife, and she gave me some advice on herbs. I'm gonna get to that in just a little bit. First, I'm gonna tell you what else happened during the ultrasound. My doctor also saw that there was still a corpus luteum. It is still active, which is why my temperature is still at a higher level at this time. So it's still at this level. I don't know what it is in Fahrenheit. I always do Celsius. So it's at 36.8 to 36.9. That is my level after ovulation and like during pregnancy or so. So I'm still producing progesterone apparently, which causes my temperature to be higher. It also means probably it's keeping me from having another period right now. So probably I have to wait till the corpus luteum kind of shrinks up and just, gets kind of dissolved a little bit. So that might take some time, because I know that all the hormones in my body, they play together. Everything is playing in perfect harmony. Even when there seems to be disharmony, your body is always trying to look for order and trying to look for the balance again. And so I just want to give my time to get into the balance. On the other hand, I think it's really cool that the corpus luteum is still active, because it tells me that if I did get pregnant with a natural cycle again, and we did a modified natural cycle for the frozen embryo transfer, then the corpus luteum really helps, I think, because, if I have a good one, that makes me happy, because one other element that functions very well naturally still in my body. So probably I have some time before I hit menopause, because it seems like a lot of my hormones still do really well, and my cycle is pretty smooth, so that's a good thing, and I'm happy about that. So my plan is to continue to exercise, I have started exercising. I have been going for runs, not crazy runs, taking it slow, maybe 1-2 miles. I have been a runner for 2 or 3 years, so I'm used to it, and I used to run like 5 miles, but I'm taking it very easy right now and also doing it very slowly. I also do yoga and stretching and some body weight workout, some HIIT trainings. So I just want to keep feeling good because I feel so good, it's crazy. I don't feel like I had a miscarriage. One more thing I forgot to tell you, my doctor, during the ultrasound, he said, okay, it looks like your body has stopped bleeding. And one other good thing he said was, it looks like your body really wanted to hold on to the pregnancy till the very end. So that is a good sign because it was a blighted ovum and I only miscarried at 10 weeks. I had the strongest pregnancy symptoms all the way till the end. And I think that's another good thing because it tells me that my body, once I'm pregnant, my body is good at holding on to the pregnancy until, something goes wrong with the embryo. And then of course it has to react and flush out anything that is not giving life. So I thought that was a good thing because it tells me that my body isn't causing the miscarriage, but it is only the genetic material. If the embryo isn't live and if it's not growing, then there's nothing that my body can do about it. So here's what my midwife told me, and I actually have this combination of what my midwife told me and what I researched on the internet. And I strongly recommend, if you had a miscarriage or even when you get pregnant, go see a midwife. Here's the plan for when I get pregnant again. I'm actually planning on not having an ultrasound. I found some research. There were 2 studies where they compared women who had early pregnancy ultrasounds and those who didn't. And there was a much higher rate of miscarriage in those who had early pregnancy ultrasounds, like at 5, 6 weeks, 7 weeks. A lot of miscarriages there seem to take place after that first ultrasound, which, you don't know if it's a causation or a correlation. However, it's not really necessary if you've never had an ectopic pregnancy, which I've never had, and I don't think I have the tendency. This was my 3rd pregnancy. Then probably it's enough just to have a home pregnancy test and maybe a blood test if you want to take your beta HCG. But essentially, all you can do is wait. And eventually, a midwife can feel the baby in your womb and she can feel if your uterus is growing. And I love that idea of, first of all, the midwife takes so much more time. She takes time. She takes a half hour or an hour to talk to me when I, go see her. And I think that part of what's going on in my soul and in my mind, that is so important. And all that ultrasound stuff, it makes me crazy because I'm so anxious and I worry. And I don't know, it's not good for me. So personally, I have decided next time I get pregnant, before I get pregnant, just to check, to get there, to prepare. I'm getting the ultrasounds, but afterwards I'm not. Research has proven that the ultrasound, when it's pointed toward the fetus or, the embryo, just the few cells, for even just a few seconds, it can heat up the cells, by a degree. And that's crazy. I think even a degree Celsius. And that could potentially do a lot of harm. So whether that's true or not, but if it's not necessary, I'm not gonna do it. I'm gonna link up an awesome video below here that is so helpful after miscarriage or before miscarriage if you have to get a DNC or about to have a DNC. So helpful. And she also talked about the miscarriage, and I'm also gonna put the link below on her website where she talks about ultrasound and how it could be harmful for the baby. So here is what I'm planning to take. I'm gonna go to the pharmacy tomorrow and I'm gonna start taking this. Pulsatilla, that is a homeopathic remedy, and also Secale. So Secale is good for when you have an incomplete miscarriage, which is what I'm dealing with. And my hope is that with the next period, and my midwife said that basically it is not uncommon for some tissue, some pregnancy tissue to be left in the uterus after the miscarriage, but with the next menstruation, it normally comes out. What I thought was really interesting was that she said that tissue in my uterus that is left potentially may grow. And so that is always one concern, and that's why they want to do a DNC. However, I'm still holding on to trying it naturally. And after my next period, I'm going to go back and have another ultrasound, and we're going to check if everything came out. I'm also taking Vitex again. I had a 3-month break now because of the pregnancy, and I have started taking it every day. One piece of information that may be useful is that I'm taking it first thing in the morning on an empty stomach. I read that your pituitary gland responds so much better when you just take it first thing in the morning. So that's what I'm doing. I'm also drinking holy basil tea with Shisandra. Those are little berries, and they are really good for the first part of your cycle. So that's what I'm taking right now. And here's the plan going forward. So after my cycle gets back to normal, hopefully, and everything looks good, and I have green light for, trying it again, and I have another ovulation. Whenever I ovulate, that's when my body is ready. Basically, if my body ovulates, it is ready. I very much believe in my body's wisdom because the past hundreds of thousands of years of wisdom is in my DNA, and I very much believe that it can do a lot on its own. So the plan is, next week I have a Skype call with another clinic in Czech. This time it's not in Prague, it's in Teplice. It's called Pronatal, and I'm gonna have a call with them, and we're gonna talk about possibly having the next transfer there if I feel that that's the right thing to do. But Andreas kind of wants to go another route. He thinks that since I got pregnant right away, it could probably still work naturally. Of course, I don't want to waste a lot of time, but it seems my body is still in good shape. So what we're going to do now, because we hadn't done this in years, is get him a spermiogram and just to check on that front, if that is all right, if the little swimmers can get to their destination, or if maybe he can take some supplements to help that along, because he has insomnia and he's taking a few medications, including some sleep medication. So I'm thinking maybe that has a negative effect. So we're gonna get that checked, and if that looks good, I want to go to a fertility clinic that is really close to us, just to have a supported natural cycle. So when I had my frozen embryo transfer, we did the HCG trigger shot to trigger ovulation. It really helps when you do timed intercourse, because I don't want it to get stressful and be like, no, we have to do it every single day. I don't want to do this more than 2-3 cycles maybe, because then it becomes stressful, and I don't also want to waste more time. So the plan is to try after my cycle returns and everything looks good on his side also. We're going to try 2 or 3 cycles naturally, but with support. The HCG trigger shot, checking also my lining if it's good, just to make sure that we have a little bit more just information about what could possibly not be okay, so that we can do something about it. I'm also going to take progesterone after ovulation, just to help along, because I am older. So maybe we are very lucky and there is one good egg and one good sperm, and maybe they meet and then we have the chance to get pregnant naturally. However, if that's not going to happen rather quickly, then we're going to move on to have that embryo transfer, the donated embryo. So those are all the updates that I have right now. I'm going to keep you updated. I'm very excited about what's to come. I hope you stay tuned. If you have not subscribed yet, I would love for you to be part of this family and to just follow along our journey, because I promised our daughter that we're not going to stop until we can't do no more. And I'm not in menopause yet. I don't think I'm close, and I'm still very fit and healthy, and it looks good. So we're just gonna keep on trying until nature says now it's over. Thank you so much for watching. Please give the video a thumbs up, because then more people can find it. And I remember that I watched so many videos over the past few years, TTC, and it has always helped me finding others who go through the same thing. So give the video a thumbs up and maybe share it. It would really help others find the video. Have a great day, and stay blessed, because it is the simple blessings that make life so meaningful.